Imagine building a billionaire empire by selling a pill that promises pain relief, but actually sparks addiction, destroys families, and kills over 800,000 people. This isn't fiction, it's the dark reality of savage capitalism in Big Pharma. Today, we're exposing how certain billionaires put profits over human lives. Get ready, these stories will shock you. Big Pharma's opioid era didn't just change medicine, it rewired pain treatment across the US. Doctors were encouraged to treat pain as the fifth vital sign, creating a massive market where opioids were prescribed longer, stronger, and more often than ever before. This shift laid the groundwork for one of the deadliest public health disasters in modern history. Next block dives straight into the Sacklers. The main players are the Sackler family, who bought Purdue Pharma in the 1950s. Things stayed quiet until 1995, when they launched OxyContin, a timed-release opioid painkiller. They marketed it as a miracle drug, and crucially, as virtually non-addictive. That was a massive lie. Purdue poured millions into aggressive sales, paying doctors to prescribe it, running fake seminars, and pushing it for everyday pain like backaches. Result? Over $35 billion in sales. The Sacklers became one of America's richest families, but others paid the price. From 1999 to now, over 800,000 opioid overdose deaths in the US alone. Millions addicted, countless families shattered, and the Sacklers? They kept cashing in, donating to museums to polish their image while the crisis exploded. In 2025, a $7.4 billion settlement was approved. Sacklers pay up to $6.5 billion over years, lose control of Purdue, but the damage is done. By the early 2000s, OxyContin prescriptions had exploded nationwide, with some rural counties receiving more pills than their entire population. Entire towns in Appalachia, the Midwest, and New England were flooded with opioids, fueling black markets and organized pill mills. While overdose deaths soared, Sackler family members personally withdrew billions from Purdue, shielding their wealth offshore. Even after criminal charges against the company, no Sackler family member served jail time, highlighting how wealth can insulate elites from consequences. John Kapoor and Insys's deadly fentanyl. Third block shifts to another key figure. It wasn't just the Sacklers. Take John Kapoor, founder of Insys Therapeutics. He developed Subsys, a fentanyl spray 100 times stronger than morphine, approved only for severe cancer pain. But Kapoor wanted more. He set up a bribery scheme, paying doctors hundreds of thousands in fake speaker fees to prescribe Subsys to anyone. They even deceived insurers to cover unnecessary doses. Profits soared. Kapoor became a billionaire. The fallout? Countless non-cancer patients addicted to ultra-potent fentanyl, leading to fatal overdoses. In 2020, Kapoor was convicted of racketeering and sentenced to prison. The harm was irreversible. Martin Shkreli, the Pharma Bro. Then there's Martin Shkreli, infamous as the Pharma Bro. In 2015, his company bought Daraprim, a vital drug for HIV patients and others with weakened immune systems, and hiked the price from $13.50 to $750 per pill, a 5,000% increase. Why? Pure monopoly, no competition, so they could charge whatever. For vulnerable patients, it meant skipped treatments, severe complications, or worse. Shkreli defended it as capitalism at work. He was banned for life from the pharma industry and ordered to pay $64.6 million in disgorgement. His old company settled for $40 million. It showed how unchecked greed turns life-saving medicine into a weapon. Analysis and final lesson. The final block wraps it up powerfully. All these stories share one thread: companies and billionaires prioritizing profit above everything. Fake marketing, bribery, lobbying to dodge regulations. The result? A crisis that still claims lives today. Capitalism isn't evil itself, but when it turns savage without ethics or rules, it kills. The question is, how much are we willing to let money cost human lives? These cases reveal structural failures, not just bad actors. Weak regulation, captured watchdogs, political lobbying, and profit-driven healthcare created an environment where harming patients became a business strategy. Even after settlements and convictions, opioid overdoses and drug affordability crises persist, proving that punishment alone doesn't fix a system designed to reward exploitation. The real lesson isn't about a few villains. It's about what happens when medicine is treated purely as a commodity, and human life becomes a line item on a balance sheet. Let me know your thoughts in the comments. Subscribe for more on the dark side of money and power. See you next time.